Janis, may I ask you to expand a bit on how you would intervene with clients who would say something like, well, it's a waste of time. I don't want to continue focusing on my body. Okay, I want to continue telling you what I've been through during the week. Or they say something like, well, I don't see the link between what I was telling you and my body. Okay, so this is a detached protector mode that's blocking also the explicit story and the implicit story, the implicit what is being expressed in the body, something like that. And then a Boolean attack sometimes who can say, shut up, you know, this is nonsense, etc. If you could expand, I mean, you touch on it, but that would be great. Thank you.
I think obviously it depends on how well you know the client, depends if you formulated the modes. I think if it's a very new client, I definitely wouldn't push them to do anything that they feel uncomfortable. I would just notice that you are on the edge of the window of tolerance. And I would respect that, first of all. I would work with developing mode language, I think, in that case, and then name the mode that's being triggered, usually a coping mode. And the way I work with coping modes with highly traumatized people is that I totally validate the mode and say, I'm glad you know where to stop. But can you tell me a little bit more about your fears? What might happen if we go a little bit further here? And instead of fighting the mode, I would align myself with the mode, and I would try to build collaborative relationship with the mode. I wouldn't try to override it, obviously, because that won't work anyway. You know, it never really works with trauma clients because the coping mode knows what the limits of the clients are. And usually it speaks on behalf of a vulnerable child that is scared of something. And usually the fear is I might get flooded. It will be too much and I won't be able to stop. I won't be able to manage, in which case it invites us to a wonderful conversation about somatic resources and think about what do you feel you might need? What might help for you to not get flooded? And maybe let's focus on that first. It's a really good point. Or it could be that the client feels really ashamed. Very often comes up, I should know this stuff. How stupid am I that I don't even know this? You know, and often then I will take a really warm, validating stance and say, it's completely understandable given, you know, what I know about you. This is not the kind of language that you spoke in your family or environment you come from, you know, and it's okay. This is exactly the space where you can learn that language. You don't need to just know it. Nobody just speaks a new language all of a sudden. We have to put a lot of work into it. But trust me, anybody can learn that over time. Where could we start? Where would be a good point for us to start without you disappearing in your shame about it? So just giving you maybe a couple of examples. But the approach generally is very, I would say, gentle, you want to stay tuned to all the modes and absolutely 100% validate their fears and lean into them more and say, just tell me more about your fears. I want to hear all about it.
Great. So that would be a time where you would do a clear integration of our traditional schema therapy approach, working with modes, the avoidant protector, protectors. Okay, great, thank you. Who else has any questions or comments?
So maybe no questions so far, but I have a couple of more slides here. Just if we think about different resources and what they are. So we could spend a long time talking about different resources, and you know, a lot of you mentioned them already. But why don't we try a few of these together now? And hopefully we'll have a little bit of time at the end to talk about anger. Some questions about that too, so I don't want to neglect that question. So a lot of people mention breath, and breath is, I think, a great starting point for a lot of clients. But like I said, we need to expect that for some clients, certain kinds of breathing, which our textbooks tell that should be more regulating for clients, actually become dysregulating. So recently I had a client who went on a special breathing course taught by a breathing specialist, who's written lots of books about it and well known. And it was something like I don't remember, I think like a 6-week course. And all the techniques sounded absolutely wonderful. But around week 4, my client couldn't continue because they were learning extremely slow breathing. And to this client, that became such a huge trigger that she started dissociating. And when we look at that, it tapped into her trauma of being choked. So there we are, there we reach a limit of where resource can become a trauma trigger, which is very possible. And the way we want to work with that, we want to explore what the edges are of how far can we stretch, how far can we use this technique in a way that actually finds that the client finds helpful rather than re-traumatizing. So in that case, we would sort of find aspects of that technique that are more regulating for the client and work with that. And then possibly over time, once we, work with parts of the client that felt traumatized by this experience, and once we process some of that, we can then return to the technique. And that's the beautiful thing. If the technique doesn't work once, or somatic research doesn't work, it doesn't mean it will never work, of course. It's often a spiral learning. It might be that at the beginning, you just learn about where the client's window of tolerance is. And you learn, okay, so the window of tolerance stops here. This is when the client goes into hyperarousal state. Okay, this is the limit of how much client is able to tolerate. But then we return to these techniques once in a while. And then I realize, oh, we can do more, so the window is expanding with a lot of other things that we've done in therapy. Yeah. So with the grounding, often grounding and orienting. You see orienting in one of the bubbles. We often confuse them. So grounding is literally sort of like feeling your feet on the floor. Why don't we do that now? We did that at the very beginning. Just take a moment and see if you can, for a second, press your feet quite firmly into the floor. And then notice what happens in the body, and just like tense your lower body just a little bit by increasing the contact between your feet and the floor. And just stay with that just a few seconds and notice what happens in your body. Another way of using grounding could be sort of leaning a little bit, pushing your back into the back of the chair. So you can do that a little bit. Make sure you don't fall off your chair, depending on what kind of chair you're sitting on. But you can maybe do that. Also, something that I sometimes do with trauma clients who need grounding, I get them to stand up and walk around the room. So there's another one, you see movement. So I would introduce some kind of movement in there. It could be just simply walking around the room. It could be something a bit firmer, like stomping feet on the floor, which also increases the amount of sensation you feel overall in your body. There's another technique. If you came to Copenhagen or before, then you may remember there's a technique where you lean against a wall. So another great technique, which in my experience works with a lot of clients, is you stand leaning against the wall and put your feet further out, maybe about 30, 40 centimeters. So quite far out, so you feel a lot of pressure on your back against the wall. Obviously, you want to do all these techniques safely, make sure client doesn't fall, goes without saying, but you can do something like that, sort of leaning against, and stay in there for quite a while. So as we do any technique, any somatic resource, we really slow down. We just don't do it for 5 seconds and then we're done. It's something we need to take a few minutes or longer, sometimes even half a session or more. Really explore, you remember the core organizers? So we stay in the resource, we stay in the posture, and then we explore what's happening in your body right now. The client says, I feel better. And then you say, oh, okay, tell me more about it. Where do you feel better exactly in your body? How does your body respond to this? What do you feel where in particular? So tell me more. So as we do this, we also keep in connection with the client. We stimulate social engagement system. We make sure client is grounded on, with the floor and the wall, but also with us in connection. So the contact is alive and it's ongoing. I have had quite a lot of sessions sitting with clients on the floor. And also I would mirror clients. So I would sit with them on the floor, even online. I sometimes recently had a client when we spent lying down on the floor the whole session. The client felt so unsafe and so ungrounded. She's a long-term client, and she knew that that is the ultimate grounding technique that was most helpful to her. So we were both of us lying on the floor and just having a session, just focusing on the body and the sensations and the contact between the floor and the body. You know, also contact outside, walking the grass, and things like that. So I'm just giving a few examples. I'm not going to go through all of these because it will be too much for now. You know, it can be things like sort of centering. You can put one hand on the chest, one hand on the belly. So also hugging ourselves. It can also be, you know, so these techniques, they overlap. It can also be containment technique where the client needs to feel maybe some kind of boundary of their skin, so we can increase the sense of boundary by doing something like, I don't know if you can see me, sort of one arm holding another, increasing the pressure. It can also be sort of giving yourself sort of little squeeze in the arms all over your body. This is a very helpful technique for clients with dissociation. It won't work for some clients because of physical or sexual abuse. Self-touch can be more of a trauma trigger. But if this is what feels better, again, quite a lot of clients of mine, something like sort of little squeezes or tapping of one's body, again, going all over the body, and little taps with fingers on the face, on the head, can be incredibly grounding. So I often do that with dissociation clients. So we already, clients I've had, you know, have strong developed relationship with. We have a sort of agreement that when they feel they're beginning to flag, sort of disappear in dissociation, we bring them out of that state before it's too late. So often clients will notice that themselves and say, oh, I need to get up now, I need to do tapping. And there we go. I don't need to do much. Clients do that for themselves, which is wonderful, which is of course what we want clients to do. Orienting technique, orienting resource is more about looking around the room and sort of, you know, this is what we often think of as grounding. So noticing certain objects in the room, noticing smells, noticing the sounds, again, really helpful. And lots of creative ways we can do that. Okay, so I'm just aware of the time, and I know there's a lot more I could speak about, but is there anything, any sort of comments about that? I just noticed questions.
There are a couple of questions, okay, from Laurie. I will read them. Can you say more about the technique of leaning against the wall with feet further out? How do clients typically experience this? And the other one is suggestions about when to use these different resources when client is in a particular mode or state.
Yeah. So good question. So the first, I'll just give a very brief answer. So the first one, leaning against the wall often gives a sense of safety for the clients. There's something about, and you know, I would welcome you to try that out, maybe after this. When you lean against a wall, it somatically creates a safety, that you know there's nothing else behind you. So it feels safe and stable. It's a similar thing when we sit on the floor and we lean against a wall or sit even in a corner. It can be particularly safe for some clients, but again, not for everyone, because for others, sitting in a corner can bring back trauma memories. So this is again about tuning in. And when do I use, so let me just pull the slides back. I actually have slides about that briefly. So yeah, so we need to distinguish when we need to manage hyperarousal or regulate hypoarousal. So we need to regulate hyperarousal. We want to downregulate clients. And we do that by creating a sense of safety. Yeah. So in a way, I would say sometimes it's easier than regulating hyperarousal because we typically use the, as we know, relaxation techniques. You're basically like slowing down the breathing, finding contact with the client. We also regulate clients with our voice, with our presence, with a calm, centered presence. Sort of like a soft look on our face. Safe, gentle eyes. So one of the things with social engagement system, the polyvagal, is we regulate, subconsciously with our body language, and we can do that by softening our face and giving client gentle looks. So this is typically when we think about social engagement system being located mainly in the facial region. If we relax orbital ocular muscles, which are the muscles around our eyes, and soften our eyelids, and then our jaw, these are the signals that communicate safety to the client. So if we relax, maybe gentle smile, the client is likely to relax with us very slowly. So we do that, but then we can also add other techniques, grounding, centering, and so on. When we think about hyperarousal, that can be more tricky. So the first thing, we want to name that state. And we want to very gently, slowly bring client back to social engagement system, but we've got to be very patient and wait for the right moment. And then when we feel the client is a little bit back with us, we can begin to add just a little bit of stimulation. So clients, let's say, who are chronically hyper-aroused and they speak like this, we might want to try and play a little bit with our own tone of voice and be a little bit higher pitch and bring a little bit more energy. And then we might bring a little bit more movement, a little activation. We can suggest even maybe playful child eventually, but not when client is completely in the hyper-aroused state, of course. And that's when we might use more sort of activation type resources, such as, tapping, movement, pulling, pushing, something that brings the energy up. Okay. All right. I hope I answered that. And I'm aware running a bit out of time. Any sort of questions about that? Any comments?